This is the Emergency Medical Minute, sponsored by Health One.
We talk a lot about how to maximize the benefit of CPR and resuscitation and cardiac arrest, and one of the things that gets talked about is mechanical CPR. This is an area of ongoing controversy in emergency medicine. We are seeing more EMS agencies and sometimes in the emergency departments the use of mechanical CPR devices such as the Lucas or the Zoll. The perceived benefits and the rationale seems to make sense. There's a way to standardize the quality of the chest compressions. The devices perform consistent CPR. There's not fatigue. There's not variability in how the compressions are done. And, especially if you have few staff or a small number of staff, you don't need to have a person doing the CPR. You can have more people doing other tasks while the machine does the CPR for you. So, there's a lot of potential benefits. However, when people look at the science, and there have been many studies, there have not been any studies that have shown a survival benefit with the mechanical CPR devices. In addition to the lack of evidence showing survival benefit, there have been several studies that have shown injuries from the mechanical devices. Most of the studies looking at injuries have been post-mortem, so it's uncertain whether the devices caused injuries that were significant, but there definitely have been abdominal and chest injuries from the devices. So several people in the field have suggested that until there's a clear benefit in proven survival, in general, the mechanical CPR devices shouldn't be used as a first option. I can see situations during prolonged transport or where staff is limited using these CPR devices, but there should be a kind of weighing of risks and benefits before they are broadly adapted, because they do have cost, they do have potential harms, and there hasn't been proven clear survival benefit.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.